Welcome back to the Osteo Physio YouTube channel. Today we are continuing with our post-pregnancy series and we're going to be looking at core restoration exercises. During pregnancy there is that normal abdominal separation. This is to allow the growth and the space for the uterus during pregnancy. So it's very common after that women experience a lot of pain, potentially around the abdomen, in the lower back, weakness around that pelvic floor. So what we're going to be talking about today are key exercises that you could typically add in around 6 to 8 weeks after pregnancy. What's really important before you do any of these is that you have this assessed by an expert first. With the exercises today, we are starting with a gentle activation of the deep core muscles, the transverse abdominis, and then building up those exercises over time. Again, you want to be working with a specialist before adding these in. So we are back with our amazing mummy MOT practitioner Molly talking through core restoration activation exercises today. So the first one is all about that TA breathing, and we did look at this with the other video of diastasis recti. As you're breathing in, you're pushing the tummy out, and as you're breathing out, you're pulling the tummy in. What's really important with this is we're doing about 3 to 5 breath cycles with this exercise. You want to make sure your back remains flat on the floor. So when you're breathing in, you're pushing the tummy out, and as you're breathing out, you're pulling the tummy in tight, almost down towards the floor, and same, almost lifting up through that pelvic floor. The next exercise we're moving on to is a glute bridge. So everybody watching will be thinking, well, you know, glute bridge works your glute muscles, but the reason why this is important when restoring your core is you can see your control when you lift up into a glute bridge. So what you're looking for is that stability. Can we hold the core tight and fire through the glutes, almost lift up through the pelvic floor as we're lifting up into that movement? So we want to aim between 10 to 15 reps with this exercise, and again, you're adding it in the whole time, activating through those deep core muscles. So you want to think with any of these exercises today, you want to be thinking about bracing through that core. What we're then doing here is you're making sure your back is flat, your core is tight, and you're going to try and push the leg out, so trying to straighten the leg. You will feel this firing in your core. Only go as far as you feel comfortable. So what it might mean initially is just going, you know, a couple of centimeters, maybe a little bit further, but the idea is as you bring the leg away, you should be engaging that core to keep your back flat on the floor and to stabilize. Next, we can make it a little bit more challenging, so this is where we're alternating arm with the legs. Only move on to this point if you've been given the okay by your specialist. All the other exercises have felt relatively comfortable, there's been no abnormal discomfort, and you feel quite confident to move on to this point. So with all of these exercises, yes, we're aiming between 10 to 15 reps on each side. You want to go lovely slow and controlled, and you want to go where's comfortable for you. The next move, very similar, so the whole time back is flat, core is firing, core is activating, and instead of pushing the leg out, what we're doing this time is we're lifting up the leg, which already puts a lot more pressure on the tummy, and then we're holding that for a second and coming back down, aiming between 10 to 15 reps on each side. When you lift the arms up, the reason why this makes it more challenging is that you're having to stabilize the whole body as you're doing this. So what you might find, if it's too much, is actually just popping the hands down by your side and then just moving the legs. So you're tailoring it based on what feels comfortable for you. Again, aiming between 10 to 15 reps on each side. Once we've then done this exercise, and again it's that lovely progression over time, the last exercise that we're going to be moving on to are those toe taps. So again, some might argue that this might be a little bit easier than the other ones, but it's just giving you an idea of how to do that. So you're lifting up both legs together, you're bracing the core and then tapping back down. So it's so important that the back is flat, your core is firing, and again, only moving on to this exercise once you've had it assessed by a specialist first, whether that's GP, midwife, or your postnatal practitioner, whether physio or osteo, and then go from there.